One of the common things that people with learning disabilities from a health problem, they experience respiratory disease. This is very common, and individuals will present at the GPs quite frequently with chest infections and respiratory problems. This in turn can lead to hospital admissions with aspiration and pneumonia. Coronary heart disease is the second highest cause of people with learning disabilities dying and having health problems. This is very common, particularly in people with Down syndrome and also the people with Fragile X syndrome. People with learning disabilities will often get dementia, and it'll be early onset dementia, particularly in the group of people with Down syndrome. People with learning disabilities also experience certain types of cancer, for example intestinal cancers, gallbladder, esophageal cancers, bowel cancers. Constipation is yet another major problem for people with learning disabilities. People often die from constipation, and this can be avoided. 80%, particularly of people with Down syndrome, will have unhealthy teeth and gums. The Death by Indifference report was so shocking that it led the government to carry out a confidential inquiry into the deaths of people with learning disability. They investigated 247 people. 37% of these people's deaths was avoidable. The confidential inquiry that was carried out in 2014 identified through their investigations that there was a clear lack of pathways for people that came into hospital. There was a clear lack of communication, a clear lack of record keeping, there was a lack of nutritional knowledge, and there were many poor quality deaths. It is really important that we listen to the recommendations that the Death by Indifference report made and those of the confidential inquiry. And more recently, listen to what Mencap, Treat Me Well and Getting It Right campaign is telling us that we need to do within our GP practices and within our acute hospitals to ensure that we do enable people with learning disabilities to have a fair, equal opportunity to access good healthcare. Diagnostic overshadowing being a main cause for people's conditions not being identified because people see the learning disability and not think beyond that, not identify that there may be a physical health issue underlying. One of the people reported in Death by Indifference was Emma, a young lady with Down syndrome who died through neglect. She attended the hospital after having been to the GP several times. She had cancer, but this wasn't identified because people were too afraid to investigate. They said she didn't cooperate. They didn't consider that she was unable to understand the need to have investigations. Best interests, the Mental Capacity Act was not followed. Martin, another gentleman in a hospital not so very far from our very own doorstep, died of neglect. Martin attended a hospital having had a stroke. He was unable to swallow. The SALT team came and assessed and put him on nil by mouth. They regularly reviewed him. He was on a drip, but at no point was his nutritional needs considered to be addressed. Martin died of starvation 26 days later. One of the recommendations was that people need to be identified within the GP practices and within the acute hospital on a flagging system so that reasonable adjustments can be made and that the person is identified as having a learning disability. Mental Capacity Act training and learning disability awareness training was a very significant point that came from the recommendations to improve the knowledge of healthcare practitioners to enable them to support people when they present as a patient. Equal access and knowledge of the Equality Act was also another recommendation. The leader review was set up to ensure that all learning disability deaths were investigated and lessons could be learned. DNAR guidelines needed to be clearly defined and appropriate. Care Passport is a really important document. It's a document that contains individual information about that person. It clearly identifies what that person's like when they're well, their baseline. This enables the medical teams to be able to identify if they're off their baseline. Within the document, it tells us about that person, how they communicate, how they express when they're in pain, what their support needs are when they're having medical interventions, how they eat and drink, what their support needs around mobilities are, what they like, what they don't like, and things that may worry or upset them, and maybe some strategies to help with that. Please use this document. It's really important to have by the patient's bedside for everyone to have access to that is caring for that person.